Bismillahirrahmanirrahim. Assalamu alaikum. Today we are going to discuss a topic that may seem trivial at first glance, but has become a significant clinical and public health issue worldwide: energy drinks. These beverages are aggressively marketed to our youth, professionals, and even athletes as boosters of energy, alertness, and performance. But behind the glossy advertising lies a complex mixture of caffeine, sugar, and other additives that may pose short and long-term health risks. As clinicians, we are increasingly encountering patients, particularly adolescents, young adults, and even pregnant women who consume these drinks regularly, often without awareness of the potential cardiovascular, neurological, and behavioral consequences. In this lecture, we will examine what energy drinks really are, their chemical composition, their effects on health, vulnerable populations, and practical strategies for counseling our patients. My aim is to equip you with evidence-based knowledge so you can recognize risks early and guide your patients towards safer choices. Bismillahirrahmanirrahim. Energy drinks, the clinical reviews. Before we begin, let me share a quick real-life situation. A 15-year-old schoolboy, Usman, comes to clinic with his mother. He is an active football player, but lately he has been complaining of poor sleep, frequent headaches, and palpitations during practice. His mother then mentions proudly, "Doctor, he takes 2 cans of his favorite energy drink before every match. It gives him extra stamina." Think, what's really happening here? Is this a harmless habit? Or is he heading towards serious health risks? And most importantly, would we as doctors have asked about energy drink use if the mother hadn't volunteered this detail? Before we begin, I would like to clarify that this session is designed solely for educational purpose. It does not replace individualized medical advice, and participants should always use their clinical judgment when applying this information in practice. By the end of this lecture, you will be able to define what energy drinks are and describe their chemical composition, recognize the short and long-term health impacts, especially in vulnerable populations, identify the addictive potential and misuse risks, counsel patients effectively on safe use and avoidance strategies. What are energy drinks? Non-alcoholic, caffeinated beverages marketed to enhance alertness, mood, and performance. They typically contain caffeine from added caffeine and are botanical sources, rapidly absorbable carbohydrates, often large sugar loads, and a mix of functional additives, taurine, guarana, ginseng, B vitamins, L-carnitine, and gluconolactone. They are distinct from sport drinks, which contains electrolytes with or without carbs and little or no caffeine. What's the chemical composition of energy drinks? Typical chemical composition of energy drinks includes caffeine, usually 80 to 320 milligram per container, but it varies widely by brands and size. Safe use benchmarks from European Food Safety Authority, that is the EFSA, says up to 200 milligram as a single dose is generally no safety concern for most adults. Up to 400 milligram per day total is acceptable. Pregnancy limit is less than 200 milligram per day. Children and adolescents, it is 3 milligram per kg per day. Then it contains sugar, often 25 to 60 gram per cane, and these are sucrose, glucose versions, the substitute non-nutritive sweetness, and we know there are public health concerns mirror those for sugar sweetened beverages. We know that. Then taurine, 0.4 to 1 gram per 250 ml typical, it's there. Guarana aids extra unbalanced caffeine. Then ginseng, B vitamins, acids, flavorings, and carbonation. Note that guarana contributes caffeine that may not be clearly disclosed on labels. Total caffeine may exceed what is printed. There's a regulatory note. Unlike colas, that is historically capped at 0.02% caffeine, energy drinks in some markets do not have a strict federal caffeine cap, and quantitative caffeine labeling can be voluntary, so consumers must check both milligram per serving and servings per container. What can be the health hazards of energy drinks? These are acute health impacts, and these include blood pressure changes, randomized control trials and meta-analytic evidence shows that with energy drinks there's increase in systolic blood pressure and diastolic blood pressure after consumption in healthy adults. There's cardiac electrophysiology changes. Multiple control studies found QTC prolongation and blood pressure rises after high volume intake, that is 32 ounce or 1 liter in 1 hour, beyond what caffeine alone would predict. Clinical significance depends on baseline risk but is concerning in susceptible individuals. Then there are neurobehavioral impacts. Short-term increase in alertness, but sleep latency prolongation is there. There's reduced total sleep time and power sleep quality. It's reduced. And these effects magnified when taken later in the day. So if the energy drinks is taken later, all these are magnified. Then there are side effects like jitteriness, tremor, nausea, palpitations, and dose-dependent caffeine effects. Who are the vulnerable populations for these side effects by the energy drinks? Children and adolescents. And we see the higher prevalence of use in this population. It is associated with sleep disruption and risk-taking behaviors. Most authorities advise avoiding energy drinks in youth. European Food Safety Authority's child benchmark is 3 mg per kg per day caffeine from all sources. Many single canes can exceed this for smaller teens. So it's a vulnerable population and we should be careful. Then pregnancy. The recommended dose is less than 200 mg per day total caffeine. The higher intakes are linked with adverse outcomes, that is small for gestational age babies, the increased pregnancy loss risk with rising caffeine use. Then comes the cardiac disease or arrhythmia, hypertension, anxiety disorders, seizure disorders, and those on interacting medications like stimulants should be counseled to avoid or strictly limit. A 2024 review also flags potential drug-independent interactions, not just caffeine. What about alcohol combination with energy drinks? Caffeine masks sedative effects of alcohol, leading people to feel less drunk. While poor impairment remains, mixing is linked to higher intensity binge drinking and more alcohol-related harms. Clinically, adverse patients advise your patients that they should not combine alcohol with energy drinks. They should not mix the alcohol in the energy drink and take. It's really problematic and it is augmenting the adverse effects of these. Then what about the addictive potential of energy drinks? They contain caffeine, which can cause dependence and withdrawal in the forms of headache, fatigue, irritability, sleepiness, and tolerance over time. Susceptibility for these varies. While these are not addictive in the opioid or nicotine sense, but there is problematic use patterns occurs especially in youth and those with underlying anxiety and sleep issues. So per se they are not addictive, but the use they develop patterns and they become dependent on it. What about the safe use thresholds of energy drinks? This is very important because now it has become part and parcel of our life. The practical risk thresholds for most healthy adults is single dose of less than 200 milligram caffeine is generally low risk. Daily less than 400 milligram per day from all sources, which means coffee, tea, cola, energy drinks, and all supplements. It should be less than 400. In pregnancy, the safe limit is 200 milligram per day. In children and adolescents, aim is to less than 3 milligram per kg per day, but preferably avoid energy drinks entirely in this group. Always individuals for body mass, comorbidities, and medications and sensitivity, it should be adjusted, and the level is not this one. It must be clear that these are upper safety limits, not recommendations. Don't exceed. Don't think that reach this level. Don't exceed these safety thresholds. What about the counseling and alternatives? When someone is in a habit of using energy drinks and to the dangerous level, how we should counsel and what alternatives should we offer? So one is audit intake. Add up caffeine from all sources. Watch for multiple servings per container and hidden caffeine, that is guarana. Time it right. Avoid after mid-afternoon to protect sleep. When we use in the evening or later on, then the sleep is disturbed, the quality and quantity of sleep is disturbed. Taper regularly if dependent. If someone is dependent on the energy drinks, then good way is to taper it gradually. Reduce 10 to 20% every 2 to 3 days. Substitute water, unsweetened tea or coffee, which are the known caffeine dose, or electrolytes sports drinks for exertion-related hydration, not stimulation. This is very, very important. For performance, prioritize sleep, hydration, meals, low in high glycemic sugars, and consider measured caffeine. That is 50 to 100 milligram rather than energy drinks if appropriate for a task. Absolutely avoid mixing with alcohol. This is very important. The red flags warranting cessation and evaluation are very important. If someone develops palpitations, syncope, chest pain, new or worsening anxiety, or insomnia, or sustained blood pressure elevation, or seizures, these are the red flags. It warrants cessation and evaluation of a person who is in habit of drinking energy drinks. Few other aspects. These are those aspects which clinicians may be asked about. For example, you may be asked, it's the taurine ginseng that gives me energy. We know the dominant active in most products is caffeine. So evidence for additive ingredients is limited, inconsistent at beverage doses, so label mistakes can mislead you. Then another aspect, you may be asked, sugar-free means healthy. Removing sugar reduces calories or glycemia, but does not remove caffeine risks, the cardiovascular risks, impact on sleep, and anxiety. And another aspect is that marketing to youth and access. Repeatedly identified as a public health concern, this has been recognized. Several countries restrict sales and marketing to minors. Youth are heavy consumers, and the policy continues to evolve. This is very, very important aspect of energy drinks. So, just a few brainstorming questions for you. First question is, which of the following is the primary active ingredient responsible for most of the stimulant effects of energy drinks? Taurine, caffeine, ginseng, or vitamin B12. So in your opinion, which of the following is the primary active ingredient which is responsible for most of the stimulant effects of energy drinks? Taurine, caffeine, ginseng, or vitamin B12? Correct answer is caffeine. While taurine, ginseng, and vitamins are present, caffeine is the dominant pharmacologically active ingredient responsible for cardiovascular and neurostimulant effects. Second question. According to international safety guidelines, which is the maximum daily caffeine intake generally considered safe for most healthy individuals? Options are 100 milligram per day, 200 milligram per day, 400 milligram per day, or 600 milligram per day. Out of these, which is correct? The correct answer is 400 milligram per day. European Food Safety Authority and other bodies set the safe upper limit at 400 milligram per day for healthy adults. Single dose should not exceed 200 milligram. The third question, why is the combination of energy drinks with alcohol particularly dangerous? Because it accelerates alcohol metabolism, or it increases blood sugar dangerously, or it makes alcohol sedative effects leading to underestimation of intoxication, or it prevents dehydration. We discussed this few minutes earlier. So what do you think? Why is the combination of energy drinks with alcohol particularly dangerous? Because it accelerates alcohol metabolism, it increases blood sugar dangerously, or it masks alcohol sedative effects leading to underestimation of intoxication, or it prevents dehydration. The correct answer is C. Caffeine counteracts alcohol-induced sedation, giving a false sense of sobriety, which encourages binge drinking and risk-taking behaviors. Question number 4. Which of the following populations should be strongly advised to avoid energy drink consumption? A. Young adults in good health. B. Children and adolescents. C. Competitive athletes. And D. Shift workers. So in your opinion, which of the following population should be strongly advised to avoid energy drinks? Young adults in good health, Are children and adolescents? Are competitive athletes? Are shift workers? Correct answer is children and adolescents. Guidelines strongly discourage energy drink use in children, adolescents due to risk of sleep disturbances, anxiety, and exceeding safe caffeine limits. Pregnant women and patients with cardiac neurological conditions are also high risk groups. So, one case history. Ali, a 19 years old university student, presents to the emergency department with palpitations, tremors, and difficulty sleeping for past 2 days. He reports drinking 3 large cans of energy drink, approximately 500 ml each, daily during exam preparation. He denies alcohol use but says energy drinks help him stay awake. His past medical history is unremarkable. On examination, blood pressure 150/95, heart rate 120 beats per minute, sinus tachycardia, ECG showing prolonged QTC that 480 milliseconds, labs within normal limits. So, the point for you is, what is the likely cause of Ali's symptoms? What is the likely cause of Ali's symptoms? Answer is excessive caffeine intake from energy drinks, compounded by possible additive effects of taurine and guarana. Second point, how should this case be managed acutely? How he should be managed acutely? Symptoms management, hydration, rest, reassurance, and monitoring is important. Second step, avoid beta agonists or stimulants. Consider IV fluids, benzodiazepines if severe agitation, and continuous ECG monitoring if arrhythmia risk is there. Another point for discussion, what preventive counseling should be given at discharge? It includes safe caffeine limits less than 400 mg per day and less than 200 mg per dose. Avoid large volume energy drinks, especially during stress periods. And discuss healthier alternatives, structured study breaks, sleep hygiene, moderate coffee and tea if needed. And warn against mixing with alcohol. So, the key messages on energy drinks. First, not harmless soft drinks. The energy drink by no means is a harmless soft drinks. Energy drinks are stimulant beverages with high caffeine and sugar. They can cause cardiovascular, neurological, and behavioral risks. The vulnerable groups must avoid, and these are children, adolescents, pregnant women, and patients with cardiac, neurologic, or psychiatric conditions, and these are at high risk. And third, counsel and prevent. Clinicians should ask about energy drink use. You must ask about when a patient presents to you in this condition. Palpitations, agitation, insomnia, all these things. Set safe limits for healthy adults, like less than 200 mg per dose and less than 400 mg per day. And strongly advise against alcohol energy drink mixing. If you remember nothing else from today's talk, please remember these three key points. Energy drinks are not harmless. Vulnerable population must avoid them. And our role is to counsel patients before problem occurs. So clinical take home. Bottom line is that for healthy, non-pregnant adults, occasional use within 200 milligram per dose and 400 milligram per day may be tolerated, but large volumes of energy drinks can raise blood pressure and prolong QTC acutely and disrupt sleep, risks that accumulates in susceptible patients. Children, teens, and pregnant patients and people with cardiac, neurologic, or anxiety disorders should avoid energy drinks. And once again, the public health concern is marketing to youth is really a public health concern. Let's remind ourselves, energy drinks are not harmless soft drinks. They are concentrated stimulants that can raise blood pressure, prolong the QTC interval, disturb sleep, and in some cases trigger serious health events, particularly in vulnerable populations. For healthy adults, occasional small amounts may not be dangerous, but routine high volume intake is clearly associated with risk. And for children, adolescents, pregnant women, and those with cardiac or neurological conditions, the safest advice remains complete avoidance. As healthcare professionals, our role goes beyond managing complications. We must actually ask about energy drink consumption and history taking, educate our patients about side limits, and advocate for better public awareness. If we can integrate this counseling into our everyday practice, we may prevent many avoidable health problems and perhaps save lives that might otherwise be lost to something as seemingly ordinary as an energy drink. Thank you for your attention.